Good afternoon, everybody. We're going to get started in just a minute. We're going to give folks another minute to join. We still have folks coming in. All right. We're going to go ahead and get started. Thank you so much for joining the Walk Cares Fund team and our guest panel for a webinar on resources for new family caregivers. For those of you who aren't familiar, Walk Cares is the state's new long-term care insurance program for workers. And our Walk Cares Conversations webinar series is designed to give you a high-level overview of a topic related to long-term care. I am your host, Kristen Mackey. I'm the Community Relations and Outreach Program Manager for Walk Cares. And I'd like to get started by going around to our panel and having each person introduce themselves briefly. Lexi, would you like to go first?
Sure. Good afternoon, everyone. My name is Lexi Bartunik. I am the Community Living Connections Program Manager here with the Aging and Long-Term Support Administration. So I work with all of our Aging and Disability Resource Centers. And I will also be supporting our Family Caregiver Support Program Manager, Dana Allard-Webb, who unfortunately can't join us because she had a power outage at her home. So I'll be discussing our Family Caregiver Support Program as well on her behalf.
Thank you, Lexi. Kelsey.
Hello, everyone. My name is Kelsey Lovick. I use she, her pronouns. I am a dementia program specialist at Northwest Regional Council, or NWRC, which is an area agency on aging.
Thank you. And Margaret.
Hello, I'm Margaret Westerveld. I'm a community services supervisor at the Area Agency on Aging and Disabilities of Southwest Washington.
Thank you so much. So we are going to get started with just a brief poll while I talk through our agenda for today. If you have a chance to take a look at those questions on your screen and answer them, that would be great. So today in our webinar, we are going to start with some remarks from our panel members, and then we will have an overview of Walk Cares to share. And finally, we will have an opportunity for audience Q&A. You are welcome to go ahead and enter your questions using the Q&A button as they come up for our panel to answer later in the webinar. And our slides and the recording of the webinar will be posted on our website. I believe the slides are actually already up on our website at walkcaresfund.wa.gov/webinars. And we're going to give folks just another minute to finish answering the poll since I see responses are still coming in. Okay, we're going to go ahead and close that out. It looks like we have about 36% of people who work in long-term care or related field, but we also have a lot of folks who are either providing unpaid care to a family member or a loved one right now, or who have done so in the past. And it looks like we have a pretty even split for how much everybody knows about home family caregiving resources. So I hope we have a little something for everyone today. And it looks like we are mostly not very familiar with the program of Walk Cares, or somewhat familiar. So hoping that overview of Walk Cares will be useful for you as well. And before we get going, we want to define what we're talking about when we say long-term care or caregiving, because we often see confusion on this point. Long-term care is help with activities of daily living, like bathing, eating, dressing, preparing meals, grocery shopping, and more. It does not include medical care like doctor's visits or treatment for medical conditions. Long-term care covers a really broad spectrum of needs and circumstances, including younger people who have been unexpectedly injured or become disabled or ill. And a lot of people don't realize what a broad range of services can be included when we talk about long-term care. We often think of it as care in a residential setting, like a nursing home or assisted living, but it can also include care provided in your own home. It's also very common for family caregivers to not realize that they are a caregiver. You might go to your mom's house a couple times a week to cook meals, drive her to appointments, and make sure she's taken her meds, which are all common care activities. And in fact, the majority of this type of care is provided on an informal basis as unpaid care from a family member, a friend, or a neighbor. And with that, I will go ahead and turn it over to Lexi.
Thank you, Kristen. So I just have a couple slides to talk about kind of, we've already started talking about that piece is what do caregivers do? And also looking at kind of identifying caregivers, and then what are some ways to access those supports and services that may be available that we'll be talking about throughout the session today. So next slide. So I always like to kind of have this quote here is there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. Caregiving is universal. And this was a quote out by Rosalind Carter, former First Lady, of everybody has had some sort of caregiving impact their lives. And so if you aren't one or haven't been one, you will be, or you know someone who has or will be. I think we all have had some sort of caregiving experience in our lives, and kind of looking at how those can be defined. So next slide. So when we think about who are caregivers, it's, very open who can be caregivers. There's so many different level of people who are providing care, whether it's unpaid caregiving support or it's paid professional caregivers. And so we always kind of like to think about is who else can be caregivers in our lives. It doesn't have to be a family member, even though a lot of times we use the terminology of family. Family is defined so differently by so many other people. And so caregivers can be a neighbor who just checks on you on occasion. It can be a friend. It can be an ex-spouse. There are a lot of, people who have chosen to stay caregiving roles, even if they may not still be married, stepchildren or grandchildren, domestic partners. Coworkers are often providing some levels of care. Godparents, godchildren. It can really be anyone in our lives can be providing some sort of care and support. It can even be, church members, pastors, hairdressers. My family is very close with the woman who's done our hair for several years, and she actually helped provide care and support to my grandmother. And so it can be people that may start as one and end up in that role as well. So really anybody can be caregivers. Next slide. One of the things that we often kind of find is a lot of people, regardless of how we may define things, have a really hard time seeing themselves as caregivers. And so whether you're currently in that role trying to determine if you are a caregiver, or supporting someone who is having a hard time determining if they are a caregiver, we have some kind of our staff are trained to kind of, which I'm going to talk about in a minute, trained to kind of help identify people who are being caregivers. And so I always kind of say, these are questions that I often would ask, and questions to think about is, do you provide someone help with anything? So transportation to medical appointments, purchasing or organizing medications. You may not be physically providing those medications, but maybe someone just needs help organizing them or picking them up from the pharmacy. Monitoring the medical condition, maybe just checking up on someone of how they're feeling one day. Communicating with their healthcare professionals. Advocating is another big one that happens with either providers or agencies providing support. Physically assisting someone to get up and down from a chair or in and out of their bed. Getting dressed, bathing or showering, any form of shopping, grocery shopping. My parents are still able to do a lot, but my brother does a lot of their grocery shopping and cooking for them. So that can be simple caregiving roles. Any housework support, preparing meals, and then managing finances is another big one. A lot of older children are like, I'm just helping them budget their checkbook. That is providing care as well. So we have all different levels of the care being provided. Is many of us are caregivers and don't even realize it. And so it's always good to kind of think about some of these questions of what you're actually doing, and we would consider you of being a caregiver. Next slide. So my role as Community Living Connections is who can you get assistance from, and how do you access those resources? And so Community Living Connections, we are a part of the Federal Aging and Disability Resource Center No Wrong Door initiative. A lot of acronyms in there, but what the No Wrong Door is it's really this partnership all the way at the federal level of people learning to figure out, excuse me, how to access services when they need them. And so a lot of our federal partners were finding that people were having a really hard time getting connected to services in a timely manner. And so all the way at the top levels, these agencies got together and decided we need to partner up from federal level to the local level to help people get connected no matter what door they come in. So this was a partnership with the Administration for Community Living, who funds a lot of the work that we do, with the Centers for Medicare and Medicaid Services, who do a lot of the Medicaid programs, as well as Veteran Services, where there are so many resources available for so many different populations of people. How can we get connected in a timely fashion? And so these aging and disability resource centers, this No Wrong Door, was really developed to be, if you go to the Veterans Administration and are needing some support that they don't provide, they can connect you with the local CLC or ADRC office. And so that's really what we are in our No Wrong Door system, which is why our CLC staff will work very closely with WalkCares. WalkCares will work very closely with our CLC teams to be able to get people connected to services that they need and community supports in a timely fashion. So the ADRCs, or what we also call CLC, Community Living Connections, is the name that we have put on our No Wrong Door system. So you will hear a lot of these terms interchangeably. So when we say ADRC, we also mean our CLC. And our ADRCs are the front door to access those services. So although Washington State has a very strong No Wrong Door system, we do need a front door. And so the front door to access services is going to be those aging and disability resource centers. Here in our state, all of our ADRC work is contracted with our area agencies on aging, which we'll hear about in more detail a little bit later. But that front door is who connects you to the services provided both at the local AAAs as well as in the communities. And our CLC staff are trained to be able to have conversations, get people connected, usually the right place at the right time, so that we can assist people as soon as assistance is needed, rather than having to wait until a deeper, more costly service is needed for someone. Our network partners, so our CLC work is contracted with our AAAs, and some is contracted from the AAAs to other community organizations. And these are places where consumers can contact us and get a wide range of supports, whether it's financial assistance is needed, whether it's just connection is needed, safely finding paid caregivers or unpaid caregivers, support groups, any supports that's needed. Our local offices are going to be very educated and trained to help find the best supports for people at the times they need. And we have many staff all at every county that are able to provide this support. Next slide. The biggest piece is how to get in touch with them. So all of those trained individuals, how do we get access to them? So CLC organizations really provide most of their services and supports via phone. They also have emails in our world now, as well as in-person conversation and office visits. The location of all of those services really depends on what the local community needs are. So in a lot of the rural communities, there may be more in-person assistance. A lot of the more urban communities may have do more of their work via the phone or email. Anybody can reach out. Community Living Connections is not income-based. It's a free service that anybody can call in or email in or reach out to get connected to whatever services are available. We do have a toll-free number that is listed on our website where people can contact that toll-free number. This number, based on where you're calling from, will direct you straight to your local office. It does not go into a queue system. It does not go into just a state call center. It literally directs you straight to your local agency to be able to be connected to services in your area. And our agencies are made to be able to connect with the others. So if you end up calling and you get connected to Bellingham, but you're needing service in Spokane, they will be able to connect you directly to your local office. Because as caregivers, we're often not calling for ourselves. We're calling for resources to support our loved ones. And so we may be long distance. I have regularly reached out to ADRC organizations in other states supporting my family members. And so it's one that these services are available everywhere. We are definitely talking about Washington here, but we can also connect to similar services in other areas. We do also have a website. The Community Living Connections website is another place where people can access services. Most of our offices are going to be the standard Monday through Friday, 8 to 5 business hours. But a lot of times, especially if we're working caregivers, may not be able to call during the day. And so all of our resources, our resource directory that our staff use is available to the public through our website. Where anybody can go online and access through a guided search any supports and services and get connected to those services. And that's online, so anytime available. It is, like I said, the resource directory that our staff use. So the same information that they have access to, we provide for you as well. Our website is going through an overhaul right now to make that even more user-friendly and accessible. So I think we do have some photos of it later on and a link to that, but there's always updates coming to that site to provide more useful information for all needed. And like I said, our services are focused on, but not limited to, older adults, adults with disabilities, and unpaid family caregivers, regardless of their economic circumstances. So whenever needing it, reach out and we can get connected to more of the services that we will continue discussing. Thank you. Next slide.
Thank you. Thanks, Lexi. We are going to go to Kelsey next.
Thank you so much, Kristen. So a lot of people start their caregiving journeys following a physical change. So somebody who maybe falls and breaks a hip or is diagnosed with an illness. But for other people, they may start their caregiving journey when someone starts experiencing cognitive change like dementia. And the first signs of this can be more subtle. Let's talk about them. Next slide, please. So someone may have a hard time managing appointments or finances. They might start giving things away or fall victim to crimes like scams or fraud. Details of recent events might become fuzzy, or you might find that the person has a hard time switching focus if they're engaged in an activity. Next slide, please. You might notice changes in how a person eats. So a person might start binge eating on snack foods or eating more ready-made foods versus cooking, or a person might forget to eat altogether. You might notice that somebody who hosts dinners is no longer able to do that, or they might stop showing up for large gatherings. Or a person can engage in unsafe cooking behaviors, so they may leave the stove on or let foods boil over. Next, please. There can also be physical changes that accompany cognitive changes. So some people might start experiencing a change in gait and the way that they walk. People can experience changes in their vision, especially when it comes to our peripheral vision, which can cause changes in somebody's ability to drive safely. Somebody may have a hard time sleeping, so they may have nightmares, they may wake up frequently in the middle of the night, or you may notice more daytime napping. For some people, this can be the first symptom of a cognitive change. You may see changes in the person's ability to initiate self-care activities, such as showering, bathing, brushing teeth. They may have a hard time managing that self-care. Next slide, please. And we also need to tune into someone's personality, mood, and behaviors. So if someone's acting out in ways that just don't seem like them, it's a really good sign that we need to pay attention because there could be something cognitively going on. So changes in somebody's ability to provide personal hygiene may result in them looking disheveled. They may become angry or suspicious if others are pointing out these changes to them. They may feel like everyone is plotting against them. People may become easily frustrated, or they may be more withdrawn from activities. So it's not that they necessarily don't want to do these activities anymore. It's just that their brain is having a hard time initiating those activities. So they need our help getting started. Additionally, somebody might act out in ways that are socially inappropriate, We may see a lack of inhibitions or somebody who's not displaying good use of their social filters. So saying things that are maybe inappropriate or rude or hurtful to others. Next slide, please. So what is the first thing that we want to do when we notice these changes? Next slide, please. I like to encourage people to take baby steps. So you don't have to do everything all at once. While it's important that we're proactive and timely, things don't move super quickly in the long-term care system. So it's important that we take baby steps and we pace ourselves. And you don't have to do everything by yourself, and you don't have to do everything all at once. The first thing that we want to do when we notice a cognitive change is make sure that the person is seen by a healthcare provider. This can help us rule out potentially reversible causes of cognitive change, such as a vitamin deficiency, an illness such as depression or an infection, or sometimes changes in medication can cause some real cognitive change in people. So we want to get those things checked out. It's really helpful if you're able to accompany the person to their medical appointment. And if you have a release of information on file with the healthcare provider's office, a lot of times you can share information such as your specific concerns with the person's healthcare provider and do so in a way that is discreet and doesn't disrespect the person. You may want to start thinking about those legal and financial documents. So looking ahead to things like a power of attorney for healthcare and finances. You might want to look at advanced medical directives. What kind of care would a person want? Should their health continue to decline? You want to make these decisions as soon as possible while the person is still able to cognitively participate in those decision-making processes. Some people find it really helpful to hold a family meeting. This can be a great way to get everybody on the same page and understand who is doing what. Finally, research local supports. Your local area agency on aging, your aging and disability resource department, like Lexi was talking about, is a really great first step to understand what long-term care programs a person may be eligible for, and also connect with your family caregiver support program. Thank you.
All right, Margaret, take it away.
Hello, thank you. Next slide. So I am from the Area Agency on Aging, and Lexi and Kelsey both kind of touched on it a little bit, what we do. But first I wanted to think about what all of us want for ourselves as we age. And a lot of us would like to age in place. And some of us don't really consider the needs of what that might include for services and supports. So let's dig into that a little bit. Next slide, please. Okay. So area agencies on aging are a nationwide source of support to help people age in place. They exist all over the country. There are 620 nationwide and 13 in Washington state. They were put in place by the Americans Act in the 70s, and they're tasked with being the boots on the ground organizations that help people live with independence in their communities and remain at home. Next slide, please. So the Older Americans Act requires that area agencies on aging, or AAAs, provide 5 core services that you can expect from any region in the United States. Elder rights, which can include protection and prevention from elder abuse and ombudsman programs, nutrition programs, specifically senior nutrition programs like congregate meal sites, home delivered meals, and senior farmers market nutrition programs. There's caregiver programs providing family caregiver support. There are health and wellness programs providing evidence-based health programs. And then there are supportive services for individuals and family caregivers, such as transportation, the building community-based support networks, and access to information and services for in-home care assistance. Next slide, please. Here is a map of the 13 area agencies in Washington state, and most people are familiar with the AAAs in Washington and what we provide, all these fantastic services we offer for in-home care, but many don't know that there's a lot more that we can do to help older adults. AAAs are often involved in planning, developing, coordination, and actual delivery of a wide variety of long-term services and supports that are all designed to help people remain in their homes. Next slide, please. So Lexi touched on this a bit, but the Area Agency on Aging has the Aging and Disability Resource Center, which is the front door of our agency. Hope that this is the one takeaway that you take from this presentation, that you can find all kinds of resources, ask questions, and access information and assistance services. They can also help you obtain screenings for various support programs, receive benefits counseling, and much, much more. They can help address the frustrations that many people feel when they're trying to learn about long-term services and supports and that are available to them. The Aging and Disability Resource Center can help people get the help they need and help them utilize the resources more wisely. This can prevent people from having to spend down their financial resources or face unnecessary placement in a care facility. People who use the Aging and Disability Resource Center can trust that they're receiving unbiased information. One of the great things about the ADRC is that the staff who work here are person-centered, and they're not going to tell you what you need, and we're not going to expect you to know exactly what services you're asking for. Rather, we will talk you through the reason of your call, gather information from you, and connect you to the resources that will work best for you. Next slide, please. At some point in many people's lives, they will experience being a family caregiver. A family caregiver is someone who routinely helps a friend, neighbor, or loved one, kind of like was touched on earlier. 55% of people who are family caregivers feel overwhelmed by the amount of care their family member needs, and 8 out of 10 people have said that they could use more support and information. As was mentioned earlier, some of the tasks that people could be doing that are not necessarily identifying themselves as family caregivers, but we could identify as family caregivers, are grocery shopping, cleaning, houseworking, care planning. In the early stages, it might look like balancing a checkbook, or maybe someone who goes and help their parent out on the weekend. Next slide, please. One of the services that we can offer and resource to help family caregivers with stress in hopes of increasing their chances of success and longevity in the family caregiver role is in-home personal care services. Respite services can provide much needed breaks for family caregivers to help with essential tasks like activities of daily living, such as mobility tasks, bathings, minimal medication management, and then instrumental activities of daily living like grocery shopping, cleaning, and housework. There are lots of different programs that are available to folks, and the types of services that they offer for those programs I will get into in the next slide, please. So other than in-home respite care, you can also access case management, obtain specialized training and education. In our local area agency, we have classes such as powerful tools, caregiver skills, exercise classes. There are lots of different types of programs being offered that can vary by county. So just reach out to your local area agency to confirm what's available in your area. You can also connect to support groups, various topics, and ways to engage. Some are virtual. They can be based on your care receiver's health conditions. You can also get a break from caregiving with in-home respite or congregate sites like an adult day center. You can also find local resources that are available to you, like supplies or equipment, and help navigating the caregiver journey and making plans for the future with like caregiving counseling. There's also other types of area agency services that are offered, like social engagement opportunities, home modification programs, emergency alert buttons, but there's a lot that might be offered in different areas. So just check in with your local area agency. And as mentioned earlier, there are health and wellness programs that are built to help empower people to self-manage and improve their health. They focus on health and wellness of older adults with disabilities. And it's a process of providing empowerment to people to self-manage and improve their health through health education, chronic disease prevention, and management. And some places like our local area agency, we have enhanced fitness classes. Next slide, please. Washington State has a few different programs that provide caregiver support, and they are for people at all income levels and resources. These programs are often either completely free or low cost to participate in. In Washington State, we assess all caregivers who want to engage with an evidence-based assessment called the T-Care assessment, and it measures where caregivers are at on their journey and how they're feeling about caregiving. Once connected, case managers help family caregivers navigate their journey using this T-Care assessment as a guide to help them determine which services would be the best support to the caregiver. The Area Agency on Aging is the best place to go to connect with an older adult or their family to a wide range of services and supports that promote independence and aging in place. Sometimes just knowing that there's a place to turn is enough for some caregivers, and it is the knowing that helps. It's like having a life preserver thrown out that's available and they can use it when they need it. Thank you.
All right, thank you. And we'll go back to Lexi.
Oh, thank you. Hello again. So we really talked about a lot of the programs that can be offered. And another thing of looking at is when you're becoming a caregiver. And so we've already mentioned that a lot of times caregivers, the biggest thing about caregivers is they don't always think of themselves as caregivers. And this is because caregiving is really ingrained into our culture. It's an honor to care for a family member or friend. And so it can be challenging to think that that can be a burden. This is something I should be doing, so I shouldn't feel stressed about it. It's really a journey that can be made much easier with all of this information, supports, and resources. And there are many things that you can do to make your caregiving journey easier and less impactful to your mental and physical health. So next slide. So really a big thing is to make a plan. If you are finding yourself needing to provide more care and support to a loved one, we all know that things go more smoothly when there is a plan. And having this plan will make your job as a family caregiver easier and safer. The organization can help build a routine, which is good for you and calming for the person that you're providing care to. Learning caregiving skills, like how to lift someone without injury or how to deal with challenging behaviors and dementia, is another way to help support. And then medical equipment and assistive technology can really help care receivers become more independent and less stressful for you. Door alarms, the emergency alert systems that were just mentioned, grab bars, ramps at the front door. There can really be some things that can be very simple that can have a very large impact in the support that we provide. Next slide. Really do your homework. The more you know, the more you will be able to plan. So really preparing yourself for caregiving by understanding the condition or illnesses that your care receiver has and what you may be able to expect in the future. Talk to other caregivers. A support group is a great place to find other people going through the same or similar experiences. Make sure your family members understand the situation, especially if you have long distance family members who may not be there from day to day and don't always just kind of fly in and cause challenges and fly back, but be able to understand what is happening and the support that you are providing. And really, like we've mentioned at every piece, and like Margaret said, if you take one thing away, of know who to contact. Contacting your local area agency on aging, your local ADRC will be able to get you connected. So if you don't remember all of these things every day, you know where to go to get that support and to remember those pieces. Next slide. So one thing we do have, this is our website that I mentioned earlier that will be getting a different look in the next few months, but you can find a lot of these resources and where to connect to your local agencies online on our website. When you go to the wasclc.org website, there are links all over for how to connect to local services. So if you click on the Connect to Local Services, it will pop up a clickable map of the state. And if you click on any county, it will provide you the local contact information for that agency. There is also options to just email the local offices straight from the website. There's several different email portals where you can literally just click a button and it'll send an email straight to the local office in your area to help get you support. Next slide. Don't be afraid to ask for help. The best start, it's best to start with these honest conversations about the situation and always, when possible, include the care receiver. You know, a lot of times people who are receiving care don't want to be that burden and want to be able for their loved ones to have the support in providing care for them. Sometimes they don't want that, but it's always good to involve when you are able to. It's really important for your own mental and physical health to ask for help from family members and friends at the beginning so that people understand what is happening and are able to provide the support that you actually need when you need that. Meet with family members and have a list of tasks, kind of, break down those tasks of maybe someone who lives out of the area can help with anything that may be online or the banking, insurance, those kind of things. And then you're able to provide that support that may be local. Talk about really dividing those tasks. Don't try to take everything on yourself, especially if there are other supports to have that. And sometimes maybe other family members are able to help support financially, of pay for additional direct care services if you're not eligible to access a lot of the programs that are available or need some additional supports. And maybe also purchasing some equipment or helping coordinate having, a loaned of medical equipment or assistive devices, but never be afraid to ask for that support. Next slide. Really making sure to take care of yourself. Margaret mentioned the assessment process that we use here in Washington. Our T-Care assessment really focuses on you as the caregiver to provide that support that you need, because it has been found time and time again of it is cost saving and mental health saving to provide the support for people who are providing that care, because they are providing unpaid care to loved ones. And so there's a cost saving both for individuals as well as for the state in providing that care and that support. So we really want to make sure that there are those resources to help you take care of yourself and give yourself a break. We do have respite opportunities available in the state, but kind of thinking of other things that may be available to provide respite, even if it's just somebody coming and sitting with your loved one, having meals prepared so that you are not having to prepare meals, one extra thing that you can take away, having someone come in just for bathing assistance and so that you're able to provide the additional care. Really learn about other options. Washington does have paid family medical leave options. So if you are working and still providing care to a loved one, there may be some options available through the state or even through your own local employer. Your employer may have employee assistance programs that may be able to provide some additional supports for you as well. Taking caregiver stress survey to kind of see what your needs may be that you didn't even think about, of what could be some stressors and supports. And then another thing is to join the Washington Family Caregiver Learning Portal. We do have provide access to a portal for learning through Trewalta that can provide education resources and supports for you as a caregiver and your loved ones. Next slide. So the Washington Caregiving Journey, this is the Trewalta program that I mentioned. It is free to all unpaid family caregivers in Washington. You can access it through your phone, through your tablet, through your laptop, and classes are available in English and Spanish. And so it's really, there are a lot of online lessons, there's support events, a lot of activities of giving just some interaction for yourself, as well as other ways to really kind of take care of yourself so that you can continue providing care to your loved one. Next slide. So some things really that people have said about our Washington Caregiver portal is really the support that's there. There's support groups and chat rooms also available, and family caregivers often share that talking with someone in the same situation is one of the best ways of learning and gaining confidence. We've already established there are many people who are currently caregivers or have been caregivers. Really talk to people you know. Most of the time, if you start up a conversation about support that you are providing to a loved one, your friends, your family, your colleagues, your coworkers, the stranger in line at the grocery store has probably experienced something similar. And although every caregiving journey is unique and individual, there are a lot of similarities and supports that can be provided in the community. Next slide. Also being prepared, paperwork is a big thing. Having educate yourself about your loved one's wishes and desires. Talk about healthcare directives, talk about power of attorney and any of those other planning documents as soon as possible, especially if you are supporting a loved one who may have dementia or memory loss, is to really ask these questions as early on. Having someone know your wishes and your desires is beneficial for you as someone who may be needing care, and it really makes your family's life easier, and it makes your life easier as a caregiver to know the desires of your loved one and be able to have as much paperwork and details in place as possible so that your wishes are met and that you are able to support your loved one's wishes. You always want to make sure that the care receiver is part of the conversation and they make those decisions, and that when you are looking at needing care, you have a trusted loved one who will follow through with the decisions that you have chosen. And the earlier, the better always in having these conversations, especially when you are supporting someone who has memory loss, and legally there may be a point where you have to take over some of those decisions. So understanding what someone's desires are is to have that as soon as possible. Sometimes having a consultation with an attorney may be necessary, and there are a lot of resources online for legal supports or family attorneys as well, if you're able to afford that option. Next slide. Really just reviewing, if you are a caregiver, now you know we've given a lot of definitions of defining how we look at caregivers. If you know someone who is a caregiver, please share the information that you have learned and educate them about the true importance of self-care, the resources that are available, the supports that are out there, and never hesitating to ask for support and help from others. Next slide. And then we just have a lot of the resources, which I believe the slides are available. So a lot of these links for legal planning, for the Community Living Connection website, the learning portal, which there is also a link to the caregiver learning portal on the Community Living Connections website as well. Caregiver stress test, kinship services as well. All of these links are available for you for additional information, because I know we've shared a lot and we're not done yet. So definitely, like we've stated, with all of the resources we've talked about so far, please, when in doubt, never hesitate to contact Community Living Connections offices, and we will connect you straight to your ADRC, your local office, your trained staff who we know all this information, so you don't have to remember it, and can provide you that support and assistance for it. Thank you.
Thank you all so much for those great resources and overview of what folks need to know. We are going to go ahead and transition into our WACARES overview. So let's talk about how the program can help families and family caregivers in the future. WACARES is a new long-term care program for Washington workers. It's an earned benefit, which means you contribute for a certain number of years in order to qualify for benefits. And it's entirely self-funded from worker contributions, which go into a dedicated trust fund that's used only for this program. Workers contribute 0.58% of each paycheck to WACARES, and you can see here what this looks like for the typical worker who makes just over $50,000 a year and would contribute $291 each year, or about $24 per month. You only contribute to WACARES while you're working. Contributions stop when you retire or if you become unemployed. And everyone is covered at the same rate regardless of pre-existing conditions. Then later, when it comes time to claim your benefits, there are no copays or deductibles, and you don't need to file claims or pay upfront for services. Instead, we connect you with contracted providers who offer the services that you want and pay those providers directly. Contributions to the program began in July 2023, and benefits will become available in 2026. This is what those contributions can look like over the course of a career. You can see that the typical worker's income is just about at the level in green here in the middle. And you can see that $290 in contributions each year totals out at $8,700 over 30 years. Everyone who is contributing to WACARES more than 500 hours per year is earning benefits, part-time and temporary workers included. And by contributing for a certain number of years, you earn access to the benefit. There are 3 different pathways that you can use to meet that contribution requirement. The first is lifetime access, and this is the pathway that we expect the majority of Washington workers will use to qualify for benefits. To use this pathway, workers must contribute for 10 years without a break of 5 or more consecutive years. And this pathway earns you access to the full benefit amount, which starts at $36,500 and grows over time with inflation. The next pathway is early access. This is for workers who have not yet been able to earn lifetime access, but have a care need while they're working or soon after leaving work. And to qualify, you need to have contributed for at least 3 of the last 6 years at the time that you apply for benefits. This pathway also earns you access to the full benefit amount of $36,500. And finally, we have a special pathway that is just for people who are near retirement. If you were born before 1968 and are therefore close to retiring as the program begins and unlikely to qualify through the 10-year pathway, you can still earn 10% of the full benefit amount for each year that you work. So for example, if you work and contribute for 500 hours or more per year for 3 years, you would earn 30% of the benefit amount, or just under $11,000, and that will also grow with inflation. Even if you only contribute for 1 year, you still earn 10% of the benefit amount. And near retirees will have permanent access to whatever percentage of the benefit amount they earn at any time they need care. They are also able to qualify through one of the other pathways if they meet those requirements. Once workers meet contribution requirements and need help with at least 3 activities of daily living, they can get access to their benefit amount, which works essentially as a budget for services and supports. With WACARES, workers get the flexibility to choose the services and supports that meet their needs. So that could mean in-home or residential care, but it could also include some of the other things that we talked about today, like home modifications to make their home safer, and assistive technology for things like medication reminders and fall detection that can help with some care needs, home-delivered meals, transportation, and more. WACARES is really designed to help people age in place in their own homes as long as possible. That's what almost all of us want to do, and most of us can if we have the right supports in place. WACARES has many options to provide support for family caregivers. You can choose someone who would otherwise be caring for you on an unpaid basis to get training and be paid, even your spouse. And WACARES can help lessen the impact on family caregivers by either paying them for their time or making sure they can get other support services. We get asked a lot about how far the benefit amount will go. And while it won't cover 100% of care for everyone, it would cover the amount of in-home care that the average Medicaid client uses for roughly a year. About a third of people need care for a year or less. So for those people, depending on what services they choose, WACARES may be able to cover all the care that they need. And for others, WACARES provides the family with immediate relief and time to plan for future care costs. These are some examples of how someone might use their benefit. They could pay the family member to care for them for about 10 hours per week for 2 years and get care supplies for a total of about $33,500. Or they could choose services to help them stay safely in their own home. They could purchase $15,000 worth of renovations like bathroom modifications or a wheelchair ramp to improve their home's accessibility, get an electric wheelchair or scooter, and have meals delivered for 3 years for around $26,800. Or someone who needs long-term care due to an unexpected injury could get 20 hours of in-home care per week for a year, plus transportation to appointments and crutches for about $34,600. We also have some great news from last legislative session. The legislature passed a new law allowing people to take their WACARES benefit with them if they move out of state. So under the new law, starting in July 2026, Washington workers can choose to continue participating in the WACARES fund if they move. To become an out-of-state participant, workers must have contributed to WACARES for at least 3 years, in which they worked at least 500 hours per year, and they must opt in within a year of leaving Washington. Like other workers, out-of-state participants will keep contributing to the fund during their working years, and the state will create a process for out-of-state participants to report their earnings and pay premiums with a focus on making it as easy as possible for those participants. And then benefits will become available for out-of-state participants starting in July 2030. And with that, we are going to move into some quick audience Q&A. We've got a couple questions in there, but if you have a question, go ahead and send it in now, and we'll get started with these. First, we've got someone asking whether the Walk Cares benefit is the same if you choose home care. Yes, it's the same amount, regardless of what type of services and supports you choose. Then we also have someone asking about the 3 of the last 6 years pathway to qualifying for benefits. I'm going to backtrack to that slide real quick so that we can talk about that. They're asking what happens if they retire in 2026 but don't need care until they are 78. And for those folks, the early access to the full benefit pathway is likely not going to be something you'll qualify for. But if you are retiring in 2026, you may be able to access the near retiree pathway to earn a prorated benefit amount, depending on what year you were born. And then we've got a question that I'm just going to toss out to the panel, which is, what advice do you give to families to help them pay for care or prepare in advance so they don't have to rely on providing unpaid care? Is there anybody who wants to talk about long-term care planning?
I can take that one. So really kind of for planning, it's have those conversations with your family to determine kind of what needs you may think there. If you do have long-term care insurance, as I know some people have it either through work or through other plans, is to really read all of the fine print about the long-term care insurance to determine what may be covered within that, how you may be able to access it. So one thing I would definitely, when you're talking with loved ones, is confirm if they do have long-term care insurance, because sometimes people have it and don't realize they have it. However, a lot of long-term care insurance plans have a lot of red tape and specifics and fine print. So you want to definitely confirm what you have first, and if there are ways to access it, what are those supports there? And really, planning and saving, understand the cost of what home care may be, understand what your loved ones or your own financial situation is. And so looking at how much savings you have, how much income is, if it is something that you may need to look at accessing Medicaid, is to really look at the savings, because a lot of the state Medicaid programs, they have a look back period of, I think it's 7 years. And so if you're wanting to plan, some older adults are wanting to plan to gift money to loved ones at certain points of life, you want to be very cautious of that if you're looking at Medicaid. So if you're in a situation where you have significant resources or you don't understand your resources, sometimes it is good to consult an attorney if you're in a position to be able to do that. There may be a cost for that, of course, but if you're confused about financial situation, you think you might have too much, or you think you might have just a little too much, having that conversation can help with some of that planning. There are private care managers out there, financial planners, things like that, of being able to make health savings accounts that are very specific to be put aside for supporting your long-term care, and really kind of, that's part of that whole planning of what you want, what your wishes are, and planning kind of around those pieces. If you really do not have those supports or that capability to provide that unpaid support, is really get a full understanding of what you have and plan and work with that of what may be available to understand, oh, Medicaid might be an option, we need to be careful of this, or Medicaid is definitely not an option, we need to start saving some for this. Those rainy day funds, understanding what constitute your rainy day, of knowing when you're able to spend those funds or support your loved ones. And so it really just goes into understanding what you have and understanding what you want and matching those up as clearly as possible. Hopefully that helped.
Thank you so much. All right, we've got someone asking if you have 2 family members who need care, can Walk Care's funds be used for both people at the same time, or is there a restriction on that? So your Walk Care's benefit is only used for taking care of you. The worker has earned their Walk Cares benefit, and then they are able to get care once they need help with activities of daily living. So in this case, if you have two family members who need care, each one of them would hopefully have earned their Walk Cares benefit and have access to that budget for services and supports. And then we have somebody asking whether Walk Cares works alongside other types of respite and long-term care resources, and whether folks can use Walk Cares as well as like the Family Caregiver Support Program or other state and federal programs at the same time. As a general rule, in terms of Medicaid long-term services and support specifically, Walk Cares should have little to no impact on Medicaid eligibility, and will be treated like a third-party payer for services the same way that private insurance is now. Generally speaking, though, people who meet Walk Cares contribution requirements and need care will generally use their Walk Cares benefit first. And then after they've used their Walk Cares benefit, they will be able to apply for Medicaid long-term services and supports if they still need care. But Walk Cares does not have any requirements that you can't be receiving other services, other supports and resources at the same time that you use your Walk Cares benefit. And then finally, we have someone asking about support group links and whether those are available on the website. I believe we have some links to those in the slides, which are already up on the website. Once again, that is at walkcaresfund.wa.gov/webinars. And with that, we are going to go ahead and close out for today. Thank you so much for joining us. We, again, have that webinar materials available on our website. If you still have questions, you can always reach out and contact us by email using the form on the contact page on the website, or using the phone numbers on your screen to make sure that you get to the right team to answer your question. And then we already have our first 2025 webinar scheduled. You can find that on our website on the webinars page that is on your screen right now. And we hope to see you again then. And have a great afternoon, everybody. Thanks for joining.